I'm going to share a couple of questions that we've received from several local employers. And one question is, how do we manage an employee that is ill and has tested positive for COVID-19? This employee will need to be out for a minimum of 10 days and 3 days with no fever, whichever is longer. The employee may work from home. When they feel they are ready to return to work, they should contact their supervisor. And when they do return to work, they should maintain a minimum distance of 6 feet between other employees or customers. And if they are unable to do that, they should wear a mask. One other question that has created some confusion amongst employers is, how do we manage an employee that has had a close contact exposure with that previous ill, positive COVID-19 employee? These employees are, first of all, defined by close contact being less than 6 feet for more than 15 minutes. If they've had that exposure, they need to be out for 14 days. They may work from home if possible. When they are ready to return to work, they should contact their supervisor. However, if during those 14 days they become ill with COVID symptoms, then they would revert back to the original recommendations from the ill employee, which is a minimum of 10-day wait time from the time they are symptomatic. So the healthy exposed employee may return to work within 14 days if they have no symptoms. An employee may actually be out longer due to an exposure, which would be 14 days, than an employee that is actually ill with COVID-19, which would only be 10 days. And that is because of the incubation period of the coronavirus.
So I think we've all learned quite a bit from COVID over the last 3 months. And as my father-in-law will say, who's a small bar and grill owner, can you please interpret some of this, information that we have out there from MDH as well as from the CDC. So once again, how do we get back to work safely and then look after our customers as well as our employees? I think healthcare in general learned a lot over the last 3 months in a location where people were coming to get care who were COVID positive, and how do you look after the healthcare workers? And I think, sitting here in front of you with the mask on, I think this might be the new normal. This might be our new uniform. And so my mask protects you and your mask protects me. The idea of social distancing as well, somewhat common sense, but a lot of that does come from the 6 feet on how can we sneeze and still get some respiratory secretions over to someone else and potentially infect them. The other key point is, if you do have chronic medical conditions, try your best to keep those under control. Keep your immune system as strong as it can be with a healthy diet, good exercise, have fun with your family. And once again, how I started this was, the thank you and thanks for respecting all that we're trying to figure this out. No one's an expert in COVID. There are a lot of folks out here all on one big team to look after the community. So like I said, the big one would be try to follow as best you can what the recommendations are. If you need interpretation, there are folks out there that would love to be able to assist your companies in getting back to work safely and looking after yourself, your coworkers, your customers, so at the end of the day they can go home safely to their family. Thank you very much.